Cubital tunnel syndrome, also known as ulnar neuropathy, is caused by increased pressure on the ulnar nerve, a nerve which passes close to the skin surface in the area of the elbow, commonly known as the funny bone. You are more likely to develop cubital tunnel syndrome if you repeatedly lean on your elbow, especially on a hard surface, bend your elbow for sustained periods, such as while talking on a cell phone or sleeping with your hand crooked under your pillow. Sometimes cubital tunnel syndrome results from abnormal bone growth in the elbow or from intense physical activity that increases pressure on the ulnar nerve. It causes symptoms of numbness and shooting pain along the middle aspect of the forearm. Today on your regular Health TV talk show, The Physicians, we will be discussing a common orthopedic disorder known as the cubital tunnel syndrome. We'll be back after the short break.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with the Physicians, where your health is our business. Today we'll be discussing a common orthopedic disorder known as the cubital tunnel syndrome. My name is Dr. Martina Agberie, and I'm not alone on this program. I have been my regular anchor. No other person than
I'm Dr. Memuna Yusuf Kadri, and of course, you know, on your favorite Health TV talk show, your health is our business.
And will always be our business.
Yeah.
So let's go to the business of today.
Yeah,
cubital tunnel syndrome. The one that most people are familiar with is the carpal tunnel syndrome. And in this program, we also discussed the carpal tunnel syndrome.
Some time back, yeah.
And some actually call that and say, doctor, there's another one they say is cubital. So I say it's cubital tunnel syndrome. So we need to also talk about it. Yeah. So let's go ahead.
But let's talk. You know, when you hear about it, and you know, with the way cell phone technology is going now, most of us are always either on our phone for like long hours. Sometimes I feel it when I'm on call for a long period of time. I feel as if my hand is numb.
The time I will feel man is when I'm sending messages, composing messages.
These days I do voice notes. I'll just introduce I say I'm sending voice notes because that you either you are rewriting your typos and all that, but you know, with voice note you're just pressing and just saying whatever you want to send. But of course, it's not everybody. If it's a business case, you can't be talking about voice notes except with family and friends and all that. But I noticed these days,
of course, it's going to be on the increase. It's going to be on the increase because a lot of people still talk on the phone.
I don't talk on the phone holding this phone most times these days. I cannot put my phone down, put it on loud, and the converse.
Maybe when you use the earpiece, it will also help people.
Yes, or sometimes the earpiece too. But like carrying phone these days, I just feel as if it's a big issue. You know, it gets numb easily, and that is another problem.
There's something that is interesting about this cubital tunnel syndrome. The places that it affects.
Yes, around the elbow, right?
And it goes, I think the consultant is going to explain the reason why. Because we're feeling some of the sensation, the pain in some parts of the fingers, and why is it like that?
It's nerve supply.
He's going to discuss it. We'll be back after this short break. Don't go away.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us here on your regular Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing a common orthopedic disorder known as the cubital tunnel syndrome. And with me in the studio we have our regular guests, a consultant orthopedic surgeon, the MD, CEO of OSTEON Clinics, Dr. Bolarinwa Akinola. Doctor, you're welcome to our program.
Thank you very much, Dr.
You're welcome, Dr. Akinola.
Thank you very much. It's a pleasure to be here again.
It's always a delight having you here.
Thank you.
Okay, so we're going to be talking about the carpal, the cubital tunnel syndrome.
Yes.
Different from the carpal tunnel syndrome,
Yes.
which you also handled some time ago.
Yes.
Do you just want to give us a general overview of the cubital tunnel syndrome? I don't know if you want to run through a little about the carpal, where it starts from, then the cubital tunnel.
Sure, absolutely. Thank you so much for that. So the carpal tunnel syndrome, we had a small talk on that the other day.
Yeah.
And it's actually the commonest hand condition that people complain about. The cubital tunnel is the second most common that people complain about. So I think it's appropriate that we're discussing cubital tunnel and carpal tunnel within the same show.
Okay.
These syndromes, as I said before, a syndrome is a constellation of symptoms that come together that is fairly consistent. And that consistency from person to person is what makes you know that, what makes you call it a syndrome, more or less. And like the carpal tunnel, the cubital tunnel also has to do with a nerve.
Okay.
There are three main nerves that run in the human upper limb. One is called the median nerve, one is called the ulnar nerve, and the third is called the radial nerve. They all start their origin from somewhere around the shoulder region, and then they run down the arm and supply the different muscles in the arm. And all these nerves can get compressed at different points. But there are some areas where they can get most commonly compressed. And for the median nerve, the most common area of compression is at the wrist. And that wrist is that compression at the wrist is what eventually results to what we call the carpal tunnel syndrome. For the ulnar nerve, the most common area where it gets compressed is at the elbow, on the inside of the elbow. And it's that constellation of symptoms that occur as a result of that compression. That's what we call cubital tunnel syndrome. So it's called a tunnel, and because it's a relatively tight space. Relatively tight in the sense that you have ligaments, you have muscles, you have bone, and they form some kind of enclosure which the nerve passes through. But because of all these other structures, it means that there's a potential tightness in those areas. So whereas the median nerve can be compressed around the elbow or maybe even higher up, but the only one you call the carpal tunnel is at the wrist. Whereas the ulnar nerve can be compressed at different levels. It can be compressed at the wrist as well. Really? Yes. But if it's compressed at the wrist, it's not called cubital tunnel. It's only called cubital tunnel where the cubital tunnel is. And that's around the elbow, on the inside of the elbow. That's where the cubital tunnel syndrome occurs. So essentially, it's a compression of one of the three major nerves of the upper limb, this time the ulnar nerve, at the elbow, on the inside of the elbow, and that's what is known as the cubital tunnel syndrome.
Wow. So you made mention of it's a syndrome of symptoms.
Yes.
Can you lay emphasis on what are these symptoms that make up the syndrome?
So most nerve compression syndromes have the same sort of signs, or sort of symptoms rather. So you go from pain to some sort of pins and needles, tingling sensation, to numbness, and then to disuse, to weakness. So most of the time, when anybody has a nerve compression, once you start having weakness, that is like a late sign. Most of the time, many people will complain of pain, will complain of tingling. As things get worse, they might complain of numbness, and then eventually gets to weakness. So when a patient comes to me and they're talking about, I have pain, I have tingling, sometimes it feels numb, that already suggests to me that this is some kind of nerve compression. And it's not just in the hand, it can happen in the legs, it can happen anywhere in the body. People a lot of times say, oh, my nerve is paining me, but just because the pain is sharp doesn't mean it's a nerve pain. Nerve pain comes with certain characteristics, and then it's usually associated with things like tingling and things like numbness as well. But specifically for cubital tunnel, the pain you feel, it's usually around the inside of the elbow, just there. If everybody feels the inside of their elbow, you feel this bony projection. Now the ulnar nerve runs in a groove just behind the bony projection. So it's not actually on the bone, it's just behind the bone. So you feel pain around there. You might feel a little bit of tingling around there, maybe a bit of numbness around the forearm. But more commonly, it's the two fingers, the pinky and the ring finger, that gets to be mostly affected, because those two fingers are innervated by the ulnar nerve. Then there are other fingers in the hand as well that are innervated by the ulnar nerve. Some muscles in the thumb are innervated by the ulnar nerve, and then some muscles in some of the other fingers. And it's a combination of these other muscles that result in the weakness when it becomes more advanced.
Wow. So it's just this pinky finger
and the ring finger. Most commonly, when you're having the pain, you either have it around the elbow, or you start feeling it around these two fingers, the little finger and the ring finger.
The ring finger, is it full or part of it?
Well, they say part of it. They say half of it. They half close to the little finger. But to be honest, a lot of people can't distinguish. So most of the time, there's usually an overlap. So they just say, the ring finger, the little finger. So both is what they complain about.
Well, so now you talked about compression, right?
Yes.
What actually causes that compression?
So it's a space that you're in, and anatomies vary from one person to another. And some people might have a slightly tighter space than others. Generally speaking, that anatomy means that in certain positions of the elbow, you are more at risk of tightening the nerve than at other times. So when you keep the arm straight, the elbow straight, the nerve is free. When you keep the elbow bent, the nerve is tight. And so if you are somebody who repeatedly keeps the elbow in that kind of position,
like somebody who makes a phone call?
Yeah, maybe if you spend a lot of time on your phone calls holding that, then that predisposes that nerve to being, because those structures are there already. When your arm is like so, it's free. But when it's like so, when it's bent, then you are more at risk of compressing that nerve, and then compression over time will start leading to the symptoms. But there are other things as well. If you've had an injury, you have a fracture, and then what is maybe a space as big as that suddenly becomes narrowed down because the bone has moved out of position, then that could be a causative factor as well. So anything that can happen to narrow that space, and one of the commonest things is positional. Putting that elbow into flexion, into a bent position, naturally closes up that space.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Those are right. Are they also at risk? Because you are always on writing. Because this, because you talked about the position of the ulnar nerve, and compressing, you are actually pressing. So does it affect people like that too?
Yeah, it can. It definitely can. So anything that makes you repetitively keep your elbow in a flex position is definitely a risk factor for developing cubital tunnel syndrome. Definitely. The only thing I'm going to quickly say as well is this. In all of these conditions, like I mentioned for the carpal tunnel, just because you're feeling these symptoms around the elbow, around the fingers, does not necessarily mean that it's coming definitively from the cubital tunnel. Notice I mentioned that the journey starts from the shoulder, actually starts from the neck as well. So sometimes a compression in the neck could mimic some of these symptoms, but there will be additional symptoms that would change the diagnosis from a cubital tunnel syndrome to something much higher up. And sometimes it could be difficult to make a distinction.
So that could just be a referred pain, right?
Yes, it could just be a referred pain because you're pressing on the source of the nerve at a higher level. And sometimes it could be difficult to make the distinction, and that's where investigations come into play.
Okay.
Things like nerve conduction studies, things like electromyography, things like your MRI scan. If you're thinking, oh, could they be coming from the neck? You can get an MRI of the neck to see whether the neck is the problem.
Okay.
But overall, these syndromes tend to be classical in the way they present, and many times you can feel fairly comfortable in making the diagnosis.
Can it be managed?
No, Dr. Akinola, before
Yes.
we even go into management, I'm trying to also find out that
Yes.
do we have an increase in incidence in presentation of cubital tunnel syndrome? Number one.
Yes.
Number two, are there gender differences? And also a particular demographic of people that have this syndrome more than other people? And then, of course, let's know what the management plan is.
All right. Thank you very much for those questions. Is there an increase? I haven't looked at the latest studies for Nigeria. I'm not sure if it's been looked at. In my practice, they rarely present to me for some reason. As I said before in the carpal tunnel discussion, for whatever reason, many people don't present with hand problems to our clinics until maybe things get really bad. They can't really make use of the hand anymore. So that's one thing. On the other question about
gender differences and demographics,
is not quite as clear-cut as it is for carpal tunnel.
Okay.
You know, carpal tunnel is more common in females.
A lot of things are more common in females. Well, we've come to accept that. Yeah.
We've accepted, right?
So the cubital tunnel is not quite like that. So there may be, maybe from population to population, they may notice some variation but globally, there's no real.
But maybe if you agree that keeping the hands there or always making a phone call, it can be a risk factor. Then maybe you want to say the women will be more at risk, right?
Maybe I'll leave that to you. I won't comment on that particular one.
Yeah. Our management. How do we manage?
Great. So again, management in managing these situations, it's always good to classify them. Mild, moderate, and severe.
Okay,
we know that for the mild cases, maybe you have a bit of pain, a bit of tingling. Management is mostly going to be non-operative.
Okay.
So measures like painkillers, wearing braces, activity modification, where you pay, maybe if you hold the phone too much, maybe get an earpiece like you mentioned earlier, so you don't have to be holding the phone to your ear all the time. So just modifying your activities, and for many people that will sort out the problem. Severe, you need surgery. When you're getting into severe is when you're already developing weakness, you're dropping things. There's a condition called clawing of the fingers, where you just notice that your two fingers, the little and the ring, are just bending. And you find out that you can't control the bend, it just stays like that. So once you start developing things like that, you find out that when you want to hold on to a piece of paper,
it drops
in that position, you're not firmly holding on, it's not as firm as it used to be. So when you're noticing things like that, that's an indication to have surgery, because that means things are getting more severe. The moderate is the bit where you want to try non-operative for some time, and if you're not seeing improvement, then you want to be advising surgery. And in those kind of situations, you might be thinking of giving a steroid injection around the area, around the nerve, just to see whether by giving an anti-inflammatory, maybe you can just settle things down a little bit. Because what you have to know about compression is, at the mild stages, the changes are reversible. At the severe stages, the changes are irreversible. And not only are the changes irreversible, the nerve is now tethered within that space of the cubital tunnel. So you then have to go in and release the nerve, free the nerve up, so that you can have more room for the nerve to breathe.
Thank you very much, Dr. Akinola. It's always a pleasure having you school us on some of the things that have to do with orthopedics, okay?
Always a pleasure.
We really appreciate it. Thank you so much. And to our viewers out there, I want to just say thank you for keeping a date with us, because your health is always our business. I'm sure you benefited from what he just told us. So for those that are always on the phones, it's always advisable, if it's possible, try and use earpiece. Try anything that will make you not to free this hand. Ensure that you avoid it. I want to say thank you again for keeping the day with us. My name is Dr. Martina Agberia.
Thank you very much, Dr. Akinola. It's always a pleasure, and of course, it's always exciting when you tell us how it is. In simple terms, very relatable. To our viewers out there, I'm sure you gain as much as we've also gained here in the studio. And you know that on your favorite Health TV talk show, The Physicians, your health is our business. If you want to be a part of the show, you are just a click away. Go to our website and fill the form, and we'll be right here just the way Dr. Akinola is. Please feel free to follow us on all our various social media platforms, Twitter, Instagram, Facebook, YouTube, and of course, remember that with West African time in Nigeria, 7:30 p.m. on Saturday, a prime time, this is where we bring the most favorite Health TV talk show to you, The Physicians. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.